Hello, I am Atul Mathur, author of writing high quality standard operating procedures. In this short video, I want to share with you one simple but highly effective strategy to improve the quality of SOPs in your organization. And this strategy can be implemented right away. But first, let's step back and look at what are the usual quality problems with SOPs. SOPs are, of course, at the core of the good manufacturing practice or GMP requirement for all pharmaceutical, biotech, and life sciences organizations. And most organizations have hundreds, if not thousands, of SOPs. And these SOPs form one of the pillars of the organization's quality system. But paradoxically, many times SOPs themselves lack quality. Yes, the very document that is supposed to drive quality itself suffers from quality problems. So what kind of problems? When I conducted a pre-training survey among the participants from a global vaccine company, majority of the participants, 83%, said SOPs were wordy. There was too much text. 67% said SOPs were complicated, difficult to understand. And 50% said SOPs were too long. Similar results were captured in another pre-training survey among the participants from the leading pharmaceutical companies in Singapore. 82% said SOPs had too much text. 59% said SOPs were complicated and too long. And 47% said the language used was imprecise and incorrect. And the story is no different when I conducted a similar survey for a laboratory at Singapore. Stepping back, we can easily see what the common SOP bugs are. SOPs, not all, but many of them, are wordy, too long, complicated, and confusing, instead of being clear, concise, and precise. So the question is, what can be done? Of course, there are many ways one can try to improve the quality of SOPs, but I want to share with you one very simple but highly effective idea that you can implement right away in your organization. But before I do that, let me share how the same idea was effectively used by the World Health Organization or WHO to solve a much bigger problem than the problem of low quality SOPs. And this problem was unsafe surgeries. In 2004, WHO was facing a worldwide crisis. Out of 230 million surgeries performed worldwide, at least 7 million patients were left disabled and 1 million patients left dead, all due to unsafe surgical practices. And to solve this problem, WHO created a task force which included some of the most eminent doctors in the world. The task force considered many different solutions like providing additional training to doctors and nurses, paying incentives, or issuing a set of guidelines. But on careful consideration, found that none of these solutions was both cost effective and practical. So finally, they came out with a solution that looked too simple at the beginning. They issued a simple checklist called Surgical Safety Checklist. The checklist included 19 checks, 7 before giving anesthesia, 7 checks before incision, and 5 checks before wheeling out the patient from the operation theatre. So did a checklist, a simple piece of paper, make a difference to unsafe surgical practices? You'll be surprised with the results. Over 3 months in a pilot implementation, major surgical complications fell by 36% and deaths fell by 47%. Imagine a simple checklist had made such a huge impact in improving surgical safety, and that too worldwide. So this is the idea. Create a checklist to check the quality of your SOPs. Now, here is an example of a checklist from my book and the workshops I have conducted. This checklist has three main parts. Number 1, format. Number 2, quality of writing. And number 3, overall quality. Format checks ensure that SOPs have a reader-friendly appearance with proper text, forms, tables, diagrams, headers and footers, etc. The second element, quality of writing, covers some of the best practices in technical writing, like writing short sentences, using imperative sentences, being concise, and so on. And the third and last element, overall quality, covers checking whether an SOP is concise, clear, correct, and compliant. Now, the main idea behind checklist is simple. You can't improve something unless you review and check it. And this principle applies to SOPs as much as it applies to any manufacturing process. So to conclude, if a checklist can improve the safety in surgeries, and that too worldwide, it can certainly improve the quality of your SOPs. Please do give it a try. Thanks for watching.